Would go into a crowd, I would feel very anxious, partly worried about getting sick again. And then partly I found out that parts of my brain were affected by COVID and affected the part of my brain that helps me recognize people.
Oh,
And that could be terrifying.
Welcome to Locala Podcast, everybody. I'm Lisa Anderson, your host and publisher of Locala Magazine, and we are doing the callbacks issue for our June issue, which means this whole month is full of wonderful podcasts of people who have been in the magazine, and today we have Lisa Midgett on the couch, and I'm super excited because when we did her podcast, well, her story, her article, it was in January 2022, and so obviously before we started the podcast, and so now we get to actually sit down and talk with her a little bit and get to know what she's been up to. You're also going to be seeing me do a couple of editing things. We're multitasking today. So if you're wondering what screen I'm tapping, that's what I'm doing. But don't forget to go ahead and hit that subscribe button and smash that like button as well. And let's head on over to Lisa. How are you doing?
I'm well, thank you. How are you?
Good. I'm good. I'm so glad to have you back in
Me
here.
too.
For a good conversation.
I'm always so happy to see you.
Yeah. So you have had quite the year plus since we have sat down and chatted last, at least in this capacity. So why don't you go ahead and let people know kind of the bigger picture of what's been going on for you?
Well, right after that January 2022 issue came out, I got COVID. It looks like about February 6th of 2022. I never tested positive. And around that time of year, I generally get bronchitis or sinus infection. And so we thought it was that and treated it like we normally would. Finally, I just couldn't get well. It was the end of February by this point. And we pulled my antibodies and bam, it showed I had COVID.
Yeah.
I just wasn't getting well. Doctors put me on bed rest, tried to treat me, several rounds of pred, antibiotics, all that. And just didn't get well. But I had multiple businesses to run and nonprofits to chair and to build, and I had work to do. So I need to say, while I was on bed rest, I took it literally, like I physically rested my body, but I had my laptop at all times. So if you have COVID, please rest your brain. Yeah. They think that perhaps my working affected my brain negatively.
Oh, really?
So yeah, I took it literally. I took bed rest. Like, sure, I'm resting physically, but I didn't rest the brain.
Yeah.
So here we are into April. When I look back at pictures during that time, April, May, June, I now know I was really pushing through. I wasn't honest enough with the people around me, and most importantly with myself, how sick I was. Mm-hmm. So we had I made it through June, kind of faked my way through it, like, I got this. And then in July, I no longer had it.
Yeah.
Fortunately, I thought something was up, and so I had requested an appointment from the University of Florida. They'd started a post-COVID program. Mm-hmm. And so I was able to see Dr. Irina Stories up there. And what I really liked about University of Florida's approach is they take a holistic approach. I expected typical doctor, and wow, she is both Eastern and Western trained. She recommends alternative medicines like acupuncture and things. She didn't I expected just to be handed a bunch of prescriptions and gone away. And that's not the way they're treating post-COVID.
Oh, fantastic.
Especially in Europe and things like that.
Yeah.
And so through meeting her, she referred me out to University of Florida neuropsychiatry.
Okay.
Right? I know these big names, big words. I'm learning all kinds of interesting things. And the reason she wanted me to go there was because she sends all of her patients to neuropsych. And there, I think through 6 sessions, they kind of explained to me what COVID has done to my body neurologically.
Okay.
I'm no scientist.
Yeah.
Okay. I'm artsy. Science is like, ooh. So they take a holistic approach, and part of that is neuropsych. And I worked with an amazing therapist there. And while I'm no scientist, I do know she explained it to me in a way that I can relate. So a lot of folks know I drive this orange sports car around town. And she saw me pull up in it one day in park, and she said, okay, imagine you're in that car of yours, and you're your right foot is all the way down on the gas,
Mm-hmm.
and your left foot is desperately trying to brake and stop you. And that's what COVID does to your neurological system. It sets everything on fire and everything is amped. So the strangest things can upset me. Losing my pen, being 5 minutes late here
Yeah.
will just like, I can feel it now even talking about it. There's a neurological response. My whole body lights up on fire. And so UF Psych helped me, neuropsych helped me realize I wasn't crazy, that these things really were happening to me. And they helped me a whole lot with understanding my changes in my emotions, changes in my temperament, changes in the way I felt about things. And that was really great. The next thing she wanted me to do was find hyperbaric. Okay. Hyperbaric is not FDA approved for post-COVID. Not much is. A post-COVID syndrome / long haul COVID. So I'm like, okay, I set out to find hyperbaric. I can't go to the hospital again. Not approved. So, okay. She didn't want me. So I kept sending her all these links to these beautiful spas that have these hyperbaric. And finally she was like, Lisa, no, I need you with a doctor. You could die. And I'm like, what? And she's like, you could die. She's like, I need you to be with a doctor. And through a friend of a friend, we found out about a Vive clinic in the Villages.
Okay.
They're an Israeli-based company. They've been in Tel Aviv, I think, 30 years or so. And they have a clinic here in the Villages. And Europe in general, the rest of the world, really started working on post-COVID, some as early as 2020, December of 2020, certainly into 2021. We were a little later here in the United States, it seems. So before I found Aviv, I thought I was headed to maybe the UK.
Oh, wow.
There's a lot of treatment programs over there. In the Netherlands, I think there's some. So
Yeah.
I was looking, I thought I would have to leave. Fortunately, I found Aviv. And, on a good day, it's 45 minutes for me, a commute. On a bad day, it's an hour and a half. But regardless, it's worth it. They're really helping me.
Yeah. Well, that's good. So you've done a lot of treatment since then. When did you actually start your treatment?
I started with the University of Florida in August. And then we got me through that with neuropsych. And then it was finding the right place. And then it was finding Aviv. And then Aviv doesn't just accept everyone.
Okay.
They really do a lot of screening. They want to make sure that not only are they right for you, but you're right for them.
Yeah.
And they also take a holistic approach. So I would say if you are suffering from post-COVID syndrome or long haul, please find a doctor who takes a holistic approach to your health, head to toe. It's not just your lungs usually, or just your heart, or just your hair loss, or just your brain fog.
Yeah.
There's a whole bunch of it going on.
Yeah.
So I spoke with Aviv, and they asked me all of my symptoms, and we can talk about that. And they said, yeah, we think we can help you. And what I have to say about all of the doctors I've been working with, whether University of Florida or Aviv, if you have a doctor who's promising you they're going to make you 100% well, yeah.
Yeah.
What I have loved and appreciated about these docs that I've worked with at both locations is they have never promised me a miracle. And yet I'm better.
Yeah. Yeah.
They have said, and I have it written down, I did a terrible art piece because I'm no artist, but just getting the words out. And I guess it kept resonating with me. You may never be the same again.
Yeah.
And I'm not.
Yeah.
And that's okay.
That's okay. Yeah. No, I think you're absolutely right. That honesty is definitely needed because you don't need the false hope and the false idea that you're going to be okay and be yourself,
Yes.
How has this affected your personal life? Because you were very busy and active in the community. As you said, you have multiple businesses and charities and all kinds of things that you have going on. So how has that really affected how you've been able to manage your day-to-day?
Extremely. Yeah, that's my whole, that is such an important question. If I were not self-employed, I would have to quit my job.
Yeah.
Fortunately for me, I have incredible people who work for me.
Yeah.
And fortunately for me, the lead time up to getting treatment was far enough in advance that I was able to say, hey, guess what? We have this joke in our family, with David and I, it's like we tell sometimes our companies, all right, what if we got hit by a bus? What would you do?
Yeah.
Well, I basically got hit by a bus.
Yeah.
And so how it's affected me in my business, I would say, is it has made the cream rise to the top. I knew my NOMA team had it. And sure enough, Mel Fiorentino, our gallery director, and Geraldo Rodriguez, our gallery manager, are killing it.
Yeah.
So they're running the gallery for me. And then Arts and Health, I have Patricia Tomlinson and Angie Grabby working for me, who are amazing, amazing people.
Yeah.
I have a great board of directors. MCA, it just happened to be that my chairmanship was ending.
Okay.
So I was like, phew. And yet I was still very active during my
Yeah.
illness. I talked to Jay Bailey weekly, if not daily,
Yeah.
And so while all this is going on, I'm still pretty aware of what's happening in my businesses, and charities, even though I'm not actively there.
Yeah.
We have a communication system that we use, Trello. And so I get lost with email. Don't email me, you guys. I won't remember. I'm sorry. I say that, and then socially, I do say that when I'm well, I will be left with no friends, colleagues, or family because my brain.
Yeah.
And
Yeah.
so speaking socially, so business-wise, my businesses are strong. They're doing great.
Yeah.
And my nonprofits doing great. Socially, Aviv gave me some answers to some things I felt but didn't understand. So I avoid large crowds. And
I do that, and I don't even have post-COVID.
Right? Yeah. For me, introvertitis, right? I've started to avoid large crowds, and I didn't know why that I was, or when I would go into a crowd, I would feel very anxious. Partly I'm worried about getting sick again. And then partly I found out that parts of my brain were affected by COVID and affected the part of my brain that helps me recognize people.
Oh,
And that could be terrifying.
Yeah, that's hard. That's difficult.
Especially folks I've met since I had COVID.
Okay.
That's a lot of folks.
Yes.
I've got a really, nice group of people I've met at the gallery and things like that. And so, and also to be someone who is a fundraiser, who has asked folks for checks. I'm terrified. What if that really nice person comes up to me and I don't remember who they are?
Yeah.
So that's like this sort of unknown anxiety I didn't realize was bothering me. And then when I talked it out, I was like, wow. And so what we're doing in there, they're having me do a training that will help me with that. And so if you want, we can talk about what this hyperbaric experience is like, because it's not like what most people, I think, expect it to be.
Yeah. Yeah.
Pretty cool.
Yeah, definitely. Feel free. Tell us what it's like.
Yeah. So what they've discovered with their research, and Aviv is not just a post-COVID syndrome clinic. They started out with traumatic brain injury, TBIs. Okay. So we have a lot of people there with concussions, strokes, things like that, and then a lot of post-COVID. It is interesting to see the clinic filling up more since I started in December.
Yeah.
So back to Aviv, we were talking a little about that. They do 3 days of testing. Okay. And so that's why I was saying a holistic approach to medicine, to your treatment, is better. They know me from head to toe. And, well, I guess we can talk a little bit about some of my symptoms before I talk about the hyperbaric.
Yeah, let's go ahead and do that.
That'll all tie in.
Yeah.
So through the testing, they're able, I have images of my brain, like 30 of them, where, the testing that they do is so intense. They can see where COVID went up my nose and affected my frontal lobe.
Wow.
They can see areas in the brain that are dead.
Oh my goodness.
Terrifying.
Yeah, terrifying
but yet,
for sure.
Yeah, while you're seeing this image, you're also with a trusted team of caretakers and medical professionals who are telling you, pretty sure we can get you, improved in this area.
Yeah.
So they do the brain scans, they do an entire physio workup, all of that bed rest while typing. Yeah, I got myself a little scoliosis now. I have a type of ADD from having COVID I never had before. My heart is affected. My lungs are affected. My skin is affected. My whole neurological system is affected. My brain is affected. So far, my toenails seem to be fine.
Hey, there's always something to be positive, right?
Yeah. So far. So far my toenails are okay. But yeah, it's just the strangest thing. And so when you get there, I really thought I would be laying on a chaise with my book or my iPad, breathing air in some kind of tented environment for 2 hours, and then I would just drive myself home.
Yeah.
No. I saw a meme, and it was perfect. It was like what I thought self-care and getting well was, and it's exactly what I described, what it really is. And it's a little girl screaming her head off on the teacup ride at Disney. She's like, ah! And that's really what getting well is. It's
Yeah.
It's hard work, but it's worth it.
Yeah.
And so, so a holistic approach. So they're working on my posture. They're working to get rid of the scoliosis. They're working on figuring out my skin issues. They're so caring and kind. And even our psychiatrist, even though we all hate him and he knows it, his name's Roger. We love him. But he's the one who decides, he and his team decide what tools, what kind of brain training you need to get those new neural pathways back so that you remember things and you can do that skill again.
Yeah.
So we go in and we get down to one atmosphere. So we all pretend we're going somewhere. And we go in and you're sitting in a reclining chair. It feels very much like an airplane. And there can be up to 14 people riding along with you.
That was the question I was going to ask. It sounded like it was a group of people.
Yeah.
Okay.
Yeah.
Okay.
It's a group of folks. And my wonderful client ambassador down there, Natalie, she told me, she's like, you're going to make friends here. And I was like, no, I don't need any friends. I got friends. Because again, thought I was going to be with iPad. No. So yeah, you do make friends. But you're in a recliner and you get down to one atmosphere and then whop, you slap your mask on. And that first 20 minutes, they're pumping 100% oxygen, And what that does is try to convince your brain you're getting oxygen poisoning. Right?
Really?
Okay, so you get that, and then you take that off, and you just breathe fresh air for about 5 minutes. Now your brain starts sending repairmen up, right?
Okay,
Your body starts sending repairmen because it's like, oh my gosh, we just got flooded with oxygen. We're in trouble here. And guess what? Stem cells are growing. Things are happening. New neural pathways are being created, right?
Okay.
Then you focus on your brain training.
Okay.
And they gave me, I see a face, and then I have to pick the face out in the next screen.
Okay.
And so they're very specific. So while there are 14 of us, we're all playing different things. Playing loosely.
Yeah.
Yeah, for graduation, I'm giving Roger a deck of cards. I'm going to be like, Roger, this is a game.
This is what you do
have
with
us
a game.
do is torture. But he knows it. But we all know that they care, and we have to do this so that our brains are better. And Lisa, I'm better. You've talked to me throughout this whole year.
Yeah.
You know how you and Chad took me to lunch, and you knew how lost I was.
Yeah, absolutely.
But admitting it to myself,
That's
everyone
hard.
around me knew I was sick.
Yeah.
But finally saying, all right, this has got to stop, and I've got to take time to get well.
Yeah.
So socially, I think I've been out since January 3rd. I went to the symphony twice. Went to MCA once, but not for an event. I just went to MCA. Been to the gallery twice. I think I made it to Ivy House twice. That's about it.
That's about it. Yeah.
Yeah. I go from my house to the clinic to my house. I'm there. It's kind of like a job. I'm there. I leave my house around 10. I get home around 4.
Yeah.
But the whole time I'm there, it's like I don't want to go. And they know it. Like I joke with them down there. I'm like every day, I don't want to go. I don't want to go. I don't want to go. But then I get there. And I'm not only surrounded by an incredible staff, people who really care about their work, I'm surrounded by other people like me.
Yeah.
And for once, instead of being embarrassed at my behavior, why I'm embarrassed about being sick, I don't know. I have other folks around me who are just as lost as me.
Yeah, I was going to say, I understand to a point about being embarrassed about being sick, and I've seen that in friends and family that have had cancer. I've seen that in myself. I've been dealing with a health issue for the last few months, and I haven't said much about it. But, it caused me to miss a deadline here at Locala, and it was the first deadline I've missed in 3 years, and it was embarrassing to have to admit that. So I can understand where you're coming from and trying, because I think people perceive it as a weakness sometimes, or that's what we think they're going to perceive it as.
Right, and that's right.
Yeah.
Is it us or is it them?
Yeah.
And I think a lot of people at Aviv were sort of, since it's an alternative medical treatment right now for post-COVID, it'll probably get approved because it is working.
Yeah.
That is something that we all talk about as a group. And before coming to talk to you today, I talked with several of my friends down there, and I'm like, what's one thing you always feel? They're like embarrassed.
Yeah.
Guilty.
Yes.
We feel guilty for being sick.
Yes.
And especially when I have friends and family, like you were saying, who have these internal diseases where on the outside they look fine.
Yeah.
And it's things like me trying to explain why I can't do the thing that the person wants me to do that's to my detriment.
Yeah.
And I say, but I'm so sick. And they say, but you look good. Well, I was a makeup artist for 2 years. Yeah, I can look good.
Yeah, I can just take a shower and put some makeup on. And be just
I can
fine.
do that.
Yeah.
But how I'm feeling, it doesn't always present.
Yeah.
And that's something I think I want to work on, is maybe awareness of that. So a lot of people feel guilty. A lot of people feel a lack of empathy from their loved ones.
Yeah.
Because we look good and we don't have cancer, right?
Yes.
They want us to keep doing the things, and so a lot of my friends down there, they're still trying to go out, they're still trying to do the things. Whereas I just decided, wow, if I'm going to take 3 months of my life off from work, off from my friendships, to do this treatment, I'm staying home.
Yeah.
So I rest.
Yeah, that's good. I think that's really smart. And I think, with any chronic illness, especially internal, anybody that has chronic pain or anything that can't be seen, that is difficult because people are like, well, you look fine.
Yep.
You're totally fine. And that's not necessarily
right.
the
They
case.
don't know that my pulse hovers at 38, 42. And I think someone at Aviv looked at me one day. I'm telling you, they're so wonderful, and they're all so smart. Gosh. Wow.
Well, I would hope so.
Right? Yeah, you do want them to be smart. And I think it was my physiologist, John. He just looked at me, and because they want to know what your life was like. What was your life like before COVID? Well, my life was riding horses. I mean, yeah, sure, working, doing all the things, but I rode horses. I did Pilates 3 days a week. I did yoga. I did strength training. I took walks. I worked 14 jobs, and so someone looked at me at one point finally, they said, so you were a really healthy 51-year-old person who got COVID, and now you have PVCs in your heart. I have scarring in my lungs. I mean, you hear me, I'm very raspy. I look different to myself. My hair is short. I'm pale. And so it's all these things. But yeah, I was a healthy 51-year-old woman who really didn't have too bad of a case of COVID. Like, I didn't end up in the hospital. I didn't end up on a ventilator, respirator, that kind of thing.
Yeah. Well, didn't you wind up with a couple of things of bronchitis leading up to it, or was that afterwards?
I think we thought it was bronchitis, but I don't remember.
Yeah.
Yeah. Short-term memory.
Yeah.
So it does seem, some interesting things, kind of cool things with the oxygen, the hyperbaric. Guess who's fluent in Spanish again?
You are.
So it's interesting creating the new neural pathways. So think about this air, Aviv is going to be like, oh, Lisa, please don't try science, Lisa. But you think about these new neural pathways that are being created in your brain. They warned us that sometimes I have PTSD from something that happened, and they warned us that sometimes when the air is coming in, it runs into a dead spot. It's like, well, let me go around that. Sometimes where it goes around may trigger a memory or a dream. And I've had some of that happen. I've had some nightmares and things. But one day there was a woman there, and she was from Chile. And one day I just realized I was speaking to her in fluent Spanish, joking, and making her and her family laugh.
No kidding.
I was able to explain why she was hungry. Hyperbaric, it does weird things to your body. So some days you're starving and some days you I don't eat, And so that's interesting to me.
Yeah.
That came back.
That's amazing. How long has it been since you felt like you could speak fluent?
I was really fluent when I was 18 living in Miami, 16 to 20.
Sure.
And then I lost it a little bit. And then being in the Paso Fino world, it came back. But now it's back with a fluency that's more like how I was as a teenager.
Okay.
It's bizarre.
Yeah.
It's bizarre.
That's amazing.
Yeah.
That's fantastic.
Yeah. So it's cool. Yeah. But so as I'm hearing it now, I also have tinnitus from COVID.
Oh,
yeah. It just kicked in.
Yeah, Hi, fun.
Tinnitus.
Hey, hello.
Yeah. But the fact that I know it kicked in means I'm getting better because I notice it now. And then one common thing I think that I see a lot at the clinic is people who are there that are my age, a lot like me.
Yeah.
Burning that candle at both ends and possibly in the middle if it has a wick. Right?
Yeah.
A lot of type A's, a lot of CEOs.
Yeah.
A lot of Fortune 500 CEOs, a lot of athletes, professional athletes. And so you can imagine a room full of those folks trying to get through a 12-week treatment program while worrying about their businesses. And most of the folks who are my age, who are going through this program, are like me. They realize that what they're doing to themselves with their businesses is killing them. And so one thought that keeps returning to me is a simple, quiet life.
Yeah.
Simple, quiet life. Yeah. I had a simple, quiet life before. And I was still able to do really amazing things in the community, for the community. And so I'm gonna shoot for that simple, quiet life by empowering the amazing people I have on my teams.
Absolutely.
We're still doing the hotel. I still got it here to do that beautiful hotel. I didn't lose the neural pathway to my design ability. So I'm really excited about that. And I want to be cautious of time, but Arts and Health is a new nonprofit initiative of the DLM Foundation.
Yeah.
Guess who's seeing it work?
Yeah.
A friend of mine, I won't mention names, but a friend of mine in the dive. Oh, we call them dives.
Okay.
Because we're going down one atmosphere.
Okay.
And most of the technicians and the people who run the hyperbaric are all scuba cert.
Okay.
Yeah. And there are also a lot of them EMTs, which I like. A lot of Ocala firefighters. Thank you, Ocala firefighters, for helping us with the. A lot of them are down there. So we've made a lot of friends in the dive.
Yeah.
And we call it, because it is like a bit of a submarine going down one atmosphere. A friend of mine wanted to dance. Most of us are not used to sitting still for 2 hours. Right?
Yeah.
In a chair.
Yeah.
And so those 5-minute air breaks are really important. We get up and we move. And she wanted music over the whole system and couldn't do that. And so we just created silent disco.
Oh.
So they give us headphones for the iPad for the brain games, Roger. And so what we did was I created a Spotify playlist.
Oh.
And I just asked everybody their songs, and I shared it with everyone, and they added. And so during our 5 minutes, many of us are standing, dancing with our headphones on to the same song.
Nice.
And those of us who can't stand, perhaps we had a stroke or something. I run around like a maniac in like the first 1 minute of that rest, putting people's headphones on if they can't, putting the music on, getting it ready. And it's so interesting to see, especially the lady from Chile was there. I believe she had dementia. We don't always ask, but she was very quiet. And then I found some Chilean music and I put it on the iPad, like classic Chilean. And I put the headphones on her. And to see her come alive, Lisa, and start dancing. She's trying to teach me moves. And we have on headphones and we have silly things on our feet, to keep clean. But it's amazing. And then they tell me, they're like, I feel euphoric. I feel like I'm doing better on my brain game. And so while I have been absent in some ways from my nonprofits, from my teams, I'm seeing their good work working with me.
Oh, that's fantastic, Lisa.
And so it's really the the amazing initiatives that I've started will continue.
Yeah.
I will be heading them all, but I won't be hands-on every day because I don't need to.
No, if you've built a good team, there's no need to.
They're way better than me.
Yeah.
They're way better.
Well, isn't that the goal, to always hire somebody smarter than you?
I always say hire to your weakness.
Yep.
Hire to your weakness.
Yeah.
And yeah, I just, and I think part of it was they needed me to get out of the way.
Yeah.
They really needed me to get out of the way and make the decisions. They're killing it.
Yeah. Oh,
So,
that's fantastic.
Yeah, so
Well, can you believe we are at the end of our time?
always believe it because you and I can talk for hours.
And just go and go. Is there anything else that you wanted to talk about that we didn't get a chance to speak on?
One thing. If you are interested in post-COVID syndrome or long haul, there's one writer that the doctors are trusting, at least Dr. Astores. She really trusts the writer Ed Young, Y-O-N-G, who writes for The Atlantic. When I read what he has to say, he's getting it right. Yeah. He's getting it right. Yeah, I would just refer to that. AvivClinics.com, there's a ton of stuff on their website. Amazing, amazing information. And then the University of Florida, Dr. Astores. Yeah. If you have post-COVID or long haul and you're not getting treated, please do, because you don't want to wait till it's too late.
Yeah.
There's some folks that it was too late for. People are dying because of post-COVID. So don't wait.
Yeah.
Get help.
Get help. Well, Lisa, thank you so much for joining us
you.
here. And we'll have to have you back to check in on how you're doing after all the treatments are done and doing all that kind of stuff. So,
I look forward to it.
Yeah, and seeing if you have really followed through on that quiet, peaceful life.
I need you and my friends to keep me in check.
Yes.
You know who you are, people. Keep me in check.
Yes, ma'am. All right. Well, thank you so much,
Thanks,
Lisa.
Lisa. I appreciate it.
And we'll make sure to have all of the links. We'll grab some links from Lisa as well for some of her favorite writers and articles and stuff to kind of help you with the post-COVID guide. If you want to learn more about us, you can visit us at www.localamag.com. And we will have, again, those links as well as to Lisa's original article, so you can see what she was up to in January 2022 as opposed to what she's doing now. So thank you for joining us here on the Locala podcast, where we focus on connections through stories.
You have like your jocks and you have, your different groups, and you stay within those groups. Mm-hmm. And when I moved to Australia, there was nothing like that. In high school, it was literally the jocks played with people that are more academic, that people that don't focus on sports at all. Like everybody just hung out for